So yeah, we had really exciting news this month. On January 10th at the University of Maryland, for the first time in its current fashion, we saw a surgeon and a team identify a patient for whom a transplant was performed involving a pig heart going into a human recipient. What's really exciting about this news is we historically have not been able to overcome the species barrier. This is called xenotransplantation. And while we have had xenotransplantation happen in humans in the past, for example, transplanting a baboon heart into a human, which happened in the 80s, these heart transplant procedures have never been shown to actually be able to sustain life in terms of a patient recovering from surgery and potentially going home. And I did speak with the primary cardiologist involved in the case, Dr. Susie Joseph, and she gave me permission a couple of days ago to share that the patient continues to do well. And we're now 18 days out, which is almost higher than the record time of 21 days with baby Faye in 1984, who was the first recipient of a non-human heart, specifically a baboon heart back then. So this is really exciting, and ultimately it's really getting a lot of us excited about what are the opportunities to continue to do this as it relates to the limited supply of organs. In the bigger picture of transplantation, this is really exciting because we have a crossroads right now where we have a growing epidemic of heart failure. By 2030, it's expected that there will be 8 million patients in the United States with a diagnosis of heart failure. And it's been said many times, to anticipate that a patient will be treated for heart failure with a heart transplant is like saying we'll treat poverty with the lottery. And generally, we don't really think about transplant as being a mainstay treatment for heart failure because we try to ultimately recover patients from heart failure. But when patients have lost all other options and we ultimately take out the old heart and put in a new one, it's a scarce resource. Ultimately, in the United States, we see about 2,000 to 3,000 transplants per year, and that has been growing above 3,000 recently. However, there's only so many hearts out there, so a lot of patients are unable to get access to the scarce resource. So there is a lot of interesting emerging technology, not only in xenotransplantation, but also in mechanical circulatory support, LVADs, as well as in donation after cardiovascular death. And all of these really exciting innovations are sort of happening at the same time. Obviously, with xenotransplantation, we have to figure out how to manipulate these non-human hearts using knockout genetic editing and CRISPR technology, which is really an exciting thing for treating cancer and treating genetic diseases. However, ultimately, being able to re-engineer a pig heart to go into a human and sustain life for more than 6 months is really going to be potentially competitive with mechanical circulatory support or total artificial heart technologies. And it's really an unusual, exciting time in heart transplantation to be able to think about all the different converging options that we have other than traditional donation after neurologic death, heart transplantation. So I think ultimately the take-home message here, as it relates to the exciting events of xenotransplantation, pig heart into a human, is we all want to see how this gentleman does. We're now 18 days out, and we ultimately want to see that this patient, this human being, has a nice extended life and ultimately is able to go home and do some life. There's a lot of unanswered questions about the ethics and the complexity of how this fits in with other technologies. But can we do it again? And can we continue to see these hearts genetically engineered to ultimately take into the human body the opportunity to promote life as an alternative to traditional transplant? So this is a really exciting time, and I look forward to seeing what comes next.